Still on health issues, health insurers now say the Affordable Care Act is not affordable for them. In order to make it so, demanding at least a 30% premium increase next year. To Dr. Janette Nesheiwat on possible insurer bailouts that are in the making here. You know, that's what tends to happen if everyone's between a rock and a hard place. Throw more money at it to make it not so bad. I think that's going to happen. I don't know in what form, Doctor, but I think that's going to happen. But I don't know if that's the answer. What do you think?
You know, 30% increase, Neil, that's outrageous. And, you know, they call it a disaster because it was just fundamentally flawed from its inception, and things are just getting worse. There's no way that patients can afford to pay an extra 30%. That's outrageous. And what's going to happen is they're not going to be able to pay their premiums. They already can't pay their co-pays and their deductibles, so they're going to end up losing their coverage. Either they're going to lose their coverage or insurance companies are going to pull out of the exchange. And when the patients lose their coverage, they're going to end up in the emergency rooms, and that's going to put a huge burden on emergency rooms. And patients that are there for true emergencies, there's going to be delays, and there can be bad outcomes with that. So it definitely is a disaster, and you know, the solution is not stopping the insurance bailouts, as they call them, but you know, that doesn't seem to be helping anyways. Insurance premiums are going up. Last year went up 12 to 13%, but in 2018, 30%? Absolutely not. I mean, patients are already struggling. They're already suffering, and that's just, there's no compassion there. That's just cruel, and we need to look at to see, insurance companies, obviously their priority is to stay in business, but
do you think,
they're
Doctor, they're
overstating
that some of them might be using this, and it is a financial crisis in the Affordable Care Act, there's no denying that, to gouge people or to demand help, and that this is their way of getting it either way. Either they're going to get the higher premiums or they're going to get the government to back them up. It's sort of like a bailout of the auto company.
Yeah, you got to look, who is it punishing if President Trump decides to pull out with paying the insurance companies? Are we punishing the patients? Are we punishing the Republicans? At the end of the day, it's going to affect our patients, so we need to do what's best for them. You know, there's no easy, clear-cut answer here, but, you know,
well, what you're hearing, Doctor, is the immediate concern is to prevent that from happening so people leave the health system or are stranded, so that they would do something to support or buck up the insurance companies, which would be a bailout by any other name.
Yeah, it would. And right now, as it is right now, the biggest problem that I'm seeing is patients can't afford their deductibles, and it's going to go even higher whether they pull out, whether they get bailed out, whether insurance companies get bailed out or not. Deductibles is one of the biggest complaints I hear from patients. They can't afford their deductibles, and even now they're delaying seeking care, and that's a huge, huge problem. For example, I had a patient, she just had what would have been a simple bladder infection. She delayed seeking medical care. All she needed was probably a few days of antibiotics, but the infection went from her bladder to her kidney into her bloodstream. She ended up in the hospital, you know, spending thousands of dollars a day on IV antibiotics, you know, when all she needed was a prescription for several days. But because they can't afford their deductibles, they don't get in to see their doctors in a timely manner, and that's where the problem is on the ground level. And it's heartbreaking to me. It's disheartening to see these costs going up higher and higher, but I don't think that paying the insurance companies is helping much, and that's one of the reasons why Senator Rand Paul was so against the bill initially, because he was against
at its core what it's doing, just supporting the system.
It doesn't seem to be making much of an effort. So.
Thank you very, very much.